In this video, you'll learn how to operate Auto Bladder Volume. We will start by turning on the Vscan Air probe by pressing and holding the button for 2 seconds. Next, pair the probe with the Vscan Air app. Now, let's open the tool. Swiping right from the left edge of the screen, please select the Auto Bladder Volume tool from the tools list. The Auto Bladder Volume Protocol, or Scan Assist, will start automatically and provide some cues to the user. This can be seen on the left side of the screen. You can hide the Scan Assist by swiping to the left or tapping on the imaging screen. We're demonstrating this on a tablet, but it will perform very similarly on a phone. This protocol consists of 2 steps, a transverse image for the height and width measurement, and the longitudinal image of the bladder for the length measurement. So there will be 2 measurements in the transverse plane and a single measurement in the longitudinal plane to get a total volume. This animation demonstrates how to place the probe for these measurements. Starting with the transverse view, place the probe in the middle of the lower abdomen, just above the pubic symphysis bone. Note how the physical orientation marker on the probe is pointed towards the patient's right. The probe is then tilted in a fanning motion, angling up and down to locate the widest point of the bladder. In the transverse plane, you'll measure the height and width like this. Moving to the longitudinal plane to measure the length. Turn the transducer 90 degrees clockwise so that the probe orientation marker is now pointed towards the patient's head. Find the longest length, all while keeping your probe positioned to visualize the entire bladder. This will provide the length measurement. These measurements will provide a final calculation for the volume. Let's try it on a patient. Remember, the physical orientation marker needs to be pointing towards the patient's right. There is a small orientation marker in the bottom left of the screen to guide you with probe placement and orientation. The Scan Assist will prompt you through all the steps in this protocol. We will start with the transverse plane. Once you've applied ultrasound gel across the curved end of the probe, place the probe horizontal across the pelvis of the patient. Tilt the probe to scan through the bladder to find the widest part of the bladder. This is what it may look like. When the widest point is visualized, push the freeze button on your probe, or tap the freeze icon on the display device. To store the measurements, tap the camera icon on the screen. Remember, bladders are different shapes and sizes. When urine is present, the bladder appears on ultrasound as a dark gray or black structure, generally surrounded by a light gray or white smooth border or bladder wall. The bladder shape can vary depending on how full it is and anatomical differences, but it's often spherical, cylindrical, cuboid, or triangular prism-shaped. If for any reason you are unhappy with the image, as shown in this example, the bladder is out of the frame, or perhaps the patient moved unexpectedly, and you weren't able to freeze on the correct view, you can repeat the scan by unfreezing and then obtain the correct image. Once frozen, the measurements will automatically appear on the image, like this. The measurements should be located at the widest and deepest edges of the bladder. Let's continue with our exam. The Scan Assist panel will automatically move to the next step. Now we need to measure the length of the bladder. We'll do this in the longitudinal view. The probe should again be placed in the center of the lower abdomen, just above the pubic symphysis bone, but this time turn the transducer 90 degrees clockwise so that the probe's orientation marker is now pointed towards the patient's head. Find the largest or widest view of the bladder by angling the probe left and right, and press the freeze button or tap the freeze icon. With a proper image, the AI will automatically place the calipers to measure the length from head to foot for this plane. Tap the camera button to store and complete the protocol. Now that all 3 measurements are stored, the software will complete the calculation and provide a volume. The report page displays the measurements in their respective planes and the final volume amount. From the report page, you can either choose Repeat to perform the workflow again, or Done to exit the Auto Bladder Volume tool. To access the images and measurements, simply go to your image gallery by swiping left from the right edge of the screen. Here you can view all saved images. Tap on the last longitudinal image of the exam to see the final measurement. Images and measurements can be easily shared directly from your image gallery. Tap Select, and select the images. Then tap Share. You can email or text. Or, if it's been set up by your health system, transfer to a DICOM server or shared folder. Delete images by tapping Select, selecting your images, and tapping Delete. A pop-up window will appear, and you will need to confirm. We recommend you configure the action button on the probe to freeze your images. Tap the top left menu, and tap Configurations. Tap the probe button action, and tap Freeze. Now when scanning, if you press the probe button, the image will freeze automatically. Once set, you will not have to repeat the step. When in the Auto Bladder Volume tool, tap the settings icon to turn the scan assist on and off. Toggling this feature off will not affect the volume calculations. However, it will hide the scan assist panel so that it doesn't automatically display at the beginning of each step. You can set Auto Bladder Volume as your default or favorite, which will make it automatically open when entering the app. Swipe to the right to open the preset panel. Simply tap and hold on the Auto Bladder Volume tool until the star appears. This is ideal for those who are primarily using Vscan Air as a bladder scanner. Here are some tips and tricks to help you obtain better images of the bladder, and help you better understand bladder scanning using ultrasound. Probe placement. It is important when performing a bladder scan to be certain that you are seeing the entire bladder on the screen. Think of the probe lens as a flashlight beam that needs to point towards the bladder. If you're finding it difficult to get the entire bladder in the field of view, the bladder may be located lower in the pelvis. Angle or rock the probe slightly towards the patient's feet or head while keeping the lens on the patient. If you notice that one side of the bladder seems to be off the screen, simply unfreeze and angle your probe left or right to center the bladder on the screen, like this. Probe pressure. Depending on patient body habitus, you may need to apply slight pressure to the probe to ensure direct contact for the entire probe lens face and skin. It is important to keep the lens or face of the transducer directly on the skin. Any cloth, such as clothing, sheets, gowns, or towels can introduce an air interface between the skin and the transducer. Be certain there is no cloth between the probe face gel and skin. Viewing device orientation. The Vscan Air app can be used in portrait or landscape. You may just need to turn your display device to landscape to switch to a wider view. Measurement corrections. The measurement calipers should be placed on the bladder wall, or the brighter border just outside the dark fluid-filled bladder on the ultrasound image. If the AI doesn't detect the bladder correctly, you may see something like this. Simply tap and slide the teardrop to correct the measurement. Remember to place the measurement at the widest point for the width and depth, like this. Proper measurement placement. For the length measurement, the calipers should be placed diagonally across the length of the bladder, from the dome to the base. You can unfreeze at any time to return to live scanning. High BMI patients. When scanning patients with a high BMI, it is important to get the probe as close to the physical bladder as possible. It may be necessary to move the pannus and place the probe beneath it to be able to image the bladder on a larger patient. You may also need to adjust the depth on the Vscan Air to see deeper into the body. Drag your finger up to increase depth. Drag your finger down on the screen for more shallow scanning. Adjust the depth as necessary to image the entire bladder on the screen. Image quality adjustments. Drag your finger left across the screen to decrease image gain or the brightness, or right to increase image gain.